unfortunately, I mean, everyone is looking for this one magic thing. Give me the magic pill, give me the magic formula that it's going to make me healthy. But the truth is that it is a symphony, and you have to have a lot of attention to detail. Even with the best thoughts in the world, you also have to have a certain key biochemicals in place. And when you get everything working properly together, then you can achieve optimal health.
Welcome to the Mindfulness Experience podcast. My name is Keith Fiveson. We're an official Wonderland Miami 2023 conference media partner. Use Mindfulness 20 for a 20% discount on your registration. Go to wonderlandconference.com. Today, a special guest is joining us, Dr. Amy Wecker. She is a board-certified internist and infectious disease specialist. She is the medical director of a health and wellness practice in Miami with extensive experience in preventative and holistic medicine. She is also completing a fellowship in anti-aging medicine to explore the benefits of regenerative medicine in slowing down aging. Dr. Amy has a unique approach to health, combining her medical expertise with her practice of yoga and breathwork. She is a strong advocate for the use of mindfulness and psychedelics in treating mental health and promoting overall wellness. We're very excited to have her on the show to share her insights and perspectives on these important topics. Hey, Dr. Amy, how are you doing? How is it going in Miami today? Welcome to the show.
I'm great, thanks. Thank you so much for having me. I'm excited to be here.
Well, I'm very excited to have you here because I really feel like you have so much to offer and so many insights to provide to the attendees at the conference. Can you tell us a little bit more about your background and how it led you to focus on health and wellness and, what you're up to?
Sure. So by my traditional training, I'm an MD and I'm certified in internal medicine, and then I subspecialized in infectious diseases. And I practiced general hospital-based infectious diseases for over 10 years. And then I got offered this job at Can Community Health, where I'm one of the medical directors. And we're not exactly a general medical practice. I said I am an infectious diseases specialist, so we're an HIV treatment and prevention clinic. And so Can is a really wonderful non-for-profit, and they give us a lot of time to properly take care of our patients. And I do have a lot of patients with complex issues, and so I like to be able to really comprehensively take care of them. Just taking HIV medication doesn't put you into the best health of your life. Health is a symphony between the mind, the body, the spirit. And I've been a long-term practitioner of yoga. And so I really try to take care of my patients as best I can. So about 7 or 8 years ago, I got introduced to some people that run an anti-aging clinic, and they were looking for a doctor. And so that really sparked my interest because I felt like there were some limitations with conventional medicine. And at that time I was practicing general infectious diseases, and I would, sometimes when I would take care of somebody for a long, complicated infection, they would ask me afterwards if I would just be their general doctor. And I was in a multi-specialty group at the time. And so I would say yes. And then they would say something like, well, I just feel tired. And so I think if you take 100 random people off the street and ask them, what's the biggest thing you've noticed as you've gotten older? Most of them will probably tell you, well, I just feel more tired. And then, but what is that, right? It is a very complex, multifactorial process. Like, everyone is tired, but why? And there's not just one reason. And I felt like my patients would say things to me like, oh, I feel tired. And I wouldn't really have anything useful to say back. I would check a couple of things. And if the thyroid seemed normal, I would say, well, I guess you're just going to be tired. And I cringe now thinking that I said that to these people. And but I didn't really know what else to do. And so So I went back to school and I actually completed my fellowship in functional medicine a
Mm-hmm.
few years ago. And so now I really practice a blend of functional medicine and conventional
Mm-hmm.
medicine. And I work for an anti-aging clinic part-time on the side.
Mm-hmm.
So we can really bring people into their optimum state of health.
So I love the fact that it's not just of taking care of a part of the body or a specific uh, diagnosis and
Disease.
yeah,
Mm-hmm.
a specific disease. You're really looking at the whole body and the whole person and what they're up to in their lives. From your viewpoint, what are your views on, I hear all the time in terms of functional medicine, really looking at the gut biomes, looking at the way that people are, not only exercising their mind, their body, their spirit, their breath work. We talked a little bit about mindfulness before. So I'm just wondering if, from your view, there is some sort of a key factor. If you're eating right, if you're sleeping right, and you're still tired, is there something else you should be doing?
Well, true health is a
Mhm.
symphony,
Mhm.
and it's really a convergence of a lot of
I
different
love that.
factors.
I
And
love that
and
idea of a symphony. It's great.
yeah, it really is. And unfortunately, I mean, everyone is looking for this one magic thing.
Mhm.
Give me the magic pill, give me the magic formula that is going to make me healthy. But the truth is that it is a symphony and you have to have a lot of attention to detail. So, of course, the mental piece is very important. We know that
Mhm.
our thoughts can make us ill and our thoughts can also make us healthy. But even with the best thoughts in the world, you also have to have a certain key biochemicals in place,
Mhm.
and when you get everything working properly together, then you can achieve optimal health. So yes, the gut microbiome is a huge piece of it,
Mhm.
hormones are a huge piece of it,
Mhm.
vitamin D,
Mhm.
positive thinking, breath work,
Right,
like
right,
all
right,
of it. But
right,
you
right.
and the older you get, the more
Mhm.
you have to tune it all in. I mean, you
Mhm.
can probably make almost everything that you need out of a Dorito when you're 20,
Mhm.
but when you're in your 40s, 50s, 60s and on, it doesn't work
Mhm.
that way anymore.
Right. Now you're going to be running a session. You're be doing a keynote and a talk at the Wonderland Conference, which really this year covers everything from longevity to psychedelics to entheogens to sex to relationships. I mean, it's all over the place, and it really is about living an optimal life. What is your session about? And maybe we can unpack that a little bit more.
So I'll be giving a talk on women's hormones, which
Hmm.
is a topic that is very dear to my heart, as I myself am 48 years old and definitely perimenopausal. And so yes,
Wait,
I'm
wait,
going to be
wait, wait,
giving.
wait. People can't see you. You're 48 years old.
Uh,
I thought you might have been in your 30s. I'm sorry, but you look
oh,
great.
thank you so much. Well, you have to remember I am an anti-aging doctor.
That's it. I think whatever you're doing, it works. I want some of that. It's great.
Come to Miami. We'll get you
Uh-huh.
taken care of.
I'll be there. I'll be there.
Yeah.
Yeah. So.
So women's hormones is it's definitely a topic that's very
Mhm.
dear to my heart. And the as we get older, I mean, unfortunately, in traditional society, and I'm saying going back, a few hundred years, women basically would give birth to 12, 14 children, and then you die. And there's not really much of a role for the aging female, and
Mhm.
society wanted to kind of throw us out. But now we're living very long lives. And I think, being alive, I mean, it's not just enough to have your heartbeat and your lungs function. You have to really feel good and be able to do the things you want to do. And as we get older, the truth is that we produce a ton of almost everything until we're about 25. And
Mhm.
then the biochemicals start to slowly decline. And not all of our hormones decline at the same rate, but generally we feel more or less perfectly fine until we're in our mid 30s, and then we
Mhm.
start to notice like, hey, things are not exactly the same as they used to be.
Right.
And by the time we're into our 40s, things are noticeably different.
Mhm.
We feel tired, we're
Mhm.
recovering more slowly, we start to look older, the sex drive disappears, our periods start to change, and so we can definitely restore the optimal health. And so I'll be talking about the different hormones and
Mhm.
what we can do to keep them balanced and at high levels.
So is there something in there about HRT, hormone replacement therapy, and or using functional mushrooms or other products like that, or psychedelics? What's the cocktail maybe might look like? Obviously, it depends on the person, right?
I mean, the cocktail really consists of hormones.
Hmm.
For women, testosterone actually is a really important female hormone, and we think of it as a male hormone, but actually, all human beings need estrogen, progesterone, and testosterone. We just need
Hmm.
them in different quantities depending on what our gender might be. So, testosterone is critically important for all people, and for whatever reason, it is generally the first hormone that women lose. So testosterone replacement is really important. And then after that, progesterone, and then finally estrogen. So look, psychedelics are amazing, and I'm definitely a big proponent of them, but
Hmm.
they are not going to substitute for the hormones that you need as you get
Hmm.
older.
Okay, so when we start taking a look at your approach to it, it's not just about, meditating or anything else. It's really about a real ability to go ahead and make sure that from an internal viewpoint, you're getting what you need in your bloodstream, the hormones specifically to go ahead and function in the world and be your optimal self.
Absolutely.
Hmm.
So, yeah, I'm a big believer in bioidentical hormones. So, bioidentical hormones are hormones that are identical to the chemical structure of the hormones that we produce.
Hmm.
So, no synthetics, compounded bioidentical hormones. And also, I mean, I think that the first thing that we do, so let's say you would come to
Hmm.
my functional medicine clinic that I work for, and we're called the Medical Health Institute, and I'll give you the
Hmm.
information. So the first thing that we do before you see anybody is we get really comprehensive blood work.
Hmm.
And then when you have a consult with myself or the other physician, we go through all of the blood work, and we design a program of supplements, and then hormones, and then maybe peptides over a series of visits to really get you feeling your best. And of course, the mental component is really important too. And we do send out,
Hmm.
videos on meditation, and we do recommend various things for the mind too, because it's very important. But again, you have to have your hormones optimized.
Right. So, from your viewpoint, what you're really doing, and this is a best practice, I would say, that you're really bringing people through a process that you're really looking at hormone management in your process. You're doing the evaluation, you're doing the assessment, and then you're giving them natural sub or ident. What was the name of that?
Bioidentical.
Bioidentical. So there's no synthetics there, is what you're saying. Yeah.
Yes. Yeah.
Okay. Hmm. And when we look at the role of mindfulness in promoting mental health and wellness, what kind of impact does that have on the individual, specifically as they're undergoing this hormone replacement therapy and looking at, upping or amping up their overall sense of energy?
Well, it has a huge impact. And so I think you could probably ask any doctor
Hmm.
about this, and they'll agree with me. I noticed very early in my career that people in general consider themselves either to be sick or to be well. And you
Hmm.
can take someone who considers themselves to be well, and they can get sick, and you can treat them and they will get better because they believe themselves to be well. They want to get better. And then you have other people that really identify with being sick, and no matter how hard you try to make them better, you can
Mm.
fix one problem and there's always going to be another problem because they are really fixated on being sick. I mean, your thoughts
Mm.
have a lot to do with how you function.
Hmm.
I think keeping the negativity out of your life, keeping yourself positive, keeping
Mm.
yourself engaged with plenty of social interactions,
Hmm.
and doing things for your brain like meditating, breathing, psychedelics, those go a really, really, really long way towards the symphony of health.
So the process of dis-ease is really around not only what's going on in your body, but also how you're feeling in your mind, what you're doing with your body, and how you're really being present to what is happening in your world. It's that sort of victor versus victim kind of mentality is what I'm hearing from you. Yeah.
Oh, 100%.
Hmm.
Yeah,
Hmm.
your
Hmm.
thoughts are very, very powerful.
Hmm.
And, we've gotten so distracted from ourselves with
Mhm.
all of the electronics and just all the stimulation in modern life that we can get very disconnected from ourselves. And when you get that disconnected from yourself, it's easy to get sick.
Hmm. Yeah, I mean the old saying, thoughts are things, and thoughts become words, words become actions, and actions become a way of life, right? For what we do or what we don't do. Let me ask you, how do you incorporate yoga and breath work into the practice with the clients? I mean, because someone might be coming to your office and they have no, experience with that. Do you just say, hey, here's a tape, or do you give them a suggested routine or anything like that?
Well, so at the Medical Health Institute, we
Hmm.
have we can send someone a video
Hmm.
with a variety of different meditation apps. But honestly, what I usually tell people within this is my
Hmm.
intro to meditation advice. What I say is to sit quietly somewhere for 10 minutes a day and just keep it to 10 minutes, but
Hmm.
make sure you do it every day. Set your cell phone timer for 10 minutes and then box breathe.
Mm.
Inhale for a count of six, hold at the top for a count of six, exhale for a count of six, hold at the bottom for a count of six,
Mhm.
and just repeat until the 10 minutes is up. I mean, I think people make things more complicated than they need to be. And I'm not saying that this is the end all be all of meditation, but I think this is a really nice place to start because you hear people say things like, oh, I'm a terrible meditator,
Right.
and of course, if you tell yourself you're a terrible meditator, then of course you're going to be a terrible meditator. But like, well, what does that even mean? I mean, I think people expect they're going to close their eyes and they go into some kind of mystical void. And it doesn't work
Right.
that way, right? You're always going
Yeah.
to have thoughts. And so I think just sitting quietly and counting your breath for 10 minutes a day is a great place to
Hmm.
start. And it can go a really long way towards
Hmm.
calming anxiety,
Hmm.
giving you some space from your
Hmm.
thoughts
Hmm.
and helping you feel better in a very uncomplicated, easy to understand kind of way.
Yeah, I really like that. Because if you can focus in on your breath and you can really kind of manage the breath, that's 666 or the 444, whatever or even, noticing where your feet are, noticing where your body
Mhm.
is, all those things. It's just about presencing, right? Being present to what is, right?
Yep. And we've lost it. Like I said, the electronics, there's a lot of ancient wisdom that people used to have that I think has gotten lost over
Mm.
the last couple, I don't know, couple of centuries maybe. And now I think there's a kind of a hunger to get those things back.
Isn't that true? Yeah, it's the medical and the mystical, the sacred and the science. So, we're going to be at this Wonderland conference, and there's going to be a lot of science and a lot of research there. There's going to be a lot of talk also about psychedelics. How do you feel, in your opinion, how do psychedelics fit into the modern, landscape of healthcare?
I mean, I am totally on team psychedelic,
Mhm.
100%. I've used psychedelics myself for many years, and I really credit them in large part to a lot of my mental health. I do consider myself to be pretty mentally healthy, and I'm pretty resilient in stressful situations, and I do really attribute a lot of that to psychedelic use. And I think you can get a lot farther in just a few well done psychedelic sessions than you
Mhm.
could probably sitting in a room talking to someone for years and years and years.
Hmm.
Specifically, I know that people are using a lot of ketamine now. I mean, I think that ketamine is an unbelievable therapeutic tool. That's the only drug right now, of course, that's legal.
Mhm.
But of course, I'm definitely on team psilocybin and team MDMA. And I mean,
Mhm.
all these things, they're just so useful.
Mhm.
I see my patients, I feel like and I don't prescribe a lot of antidepressants and stuff, but of course my patients have other doctors too, and
Mhm.
I feel like at least a quarter of them are on some kind of antidepressant, and I mean, there has to be a
Mm.
better way.
Yeah, the SSRIs, the efficacy rates aren't really that high when you look at it. And, I think, especially when it comes to treatment resistant depression, suicidal ideation, I'm a psychedelic assisted therapy provider and working with a ketamine clinic locally. And really unbelievable results from seeing people who come in totally depressed, 2, 3, 4 sessions, that maybe 6 sessions afterwards with some maintenance. They're they're really coping and they're really present to what's going on. And what do you think that's about? Is it just kind of, I use the term, step away, take your hands off the wheel and step away from the vehicle. Is there some of that with the disassociative viewpoint in your view?
Yeah, I think that the psychedelics they take you into the center of yourself. I mean,
Mm. Mhm.
as especially, yeah, I tell my patients pretty frequently that I recommend ketamine over antidepressants, and I think that yeah, they take you into the center of yourself, and you're
Mhm.
able to really see what's going on. And with ketamine specifically, I feel like you're almost able to go inside your brain and fix things. You kind of ask the ketaverse for what you need, and you receive messages and you
Mhm.
receive healing. And it's
Mm.
I've done it myself several times, and I think it's very powerful.
I like that. I haven't heard that term before, the ketaverse.
The
Yeah.
ketaverse,
That's great.
that's how I feel when I go in
I love
there.
that. I love that. The ketaverse. Hi, meow. Oh, that's wonderful. So, some people like yourself and others, we talk about the transformative effects on consciousness, the ability to go into the ketaverse and to go ahead and make some adjustments to to what extent have you seen that in your practice and working with, some people and, do you have any kind of anecdotal kind of examples where, you don't have to give names or anything like that?
Well, yeah, well, I actually have been taking care of this
Mhm.
one woman for a while, and she's a wonderful human being on a ton of different psychiatric drugs. And they get changed. She has a psychiatrist. She comes back. She's on different things. She's been very unhappy. It took me a while, but I finally convinced her to go see my friend Dr. Michelle Weiner, who runs an amazing ketamine clinic down here in Miami, and Dr. Michelle is actually the one that kind of hooked me up with this talk at
Mhm.
Wonderland. So
Right.
anyway, she did. It took me a long time, but she finally did agree to go see her.
Mhm.
And I saw her after she had just had one of her ketamine treatments. She's going to have a series of six, and she said it was just unbelievable that she just realized so much stuff about herself, and that a
Mm.
lot of the depression seemed lifted, and she felt lighter and she felt freer. I mean, and it was so dramatic. And I think that's the thing. Like it is dramatic because you have such a profound experience going into a realm that is totally different than the one that we
Mm.
perceive on a daily
Mhm.
basis.
So the ketaverse, you moving into the move. I am gonna lift that from you. I swear, Amy. Thank you
Please
very much.
take it, enjoy it.
That's very good. I love that. So, when we start taking a look at that, like doing that internal psychic surgery, if you will, being able to step away from the vehicle, see what's going on with the vehicle itself, where you have been, where you are now, maybe where you need to go, and then coming back out, having a different perspective in terms of who you are, what's happened, and where you're maybe going, right?
Oh, 100%.
Mhm. Mhm.
And I think it's so profound.
Mm, mm.
I
So
think yeah, the SSRIs they just blunt you.
they blunt you. Yeah, they don't necessarily deal with the neurogenesis or the neuroplasticity of the brain, and they really don't give you that space to really kind of see what's been or deal with some of the trauma or some of the issues that might be holding you back. Clogging the works, if you will. I'm wondering along that line, as you start looking at these hormonal balances, with menopause or other things with helping women, what's the role for psychedelics in that? Is there a role that you can speak to? Do you think there's an opportunity, whether or not I was talking with someone who was talking about moms, microdosing moms, moms who microdose every single day, and there seems to be, and I've seen some articles on it, seems to be a real sort of thing right now where, it used to be the mother's little helper, some Valium back in the day, but nowadays it's really about how do I be present? How do I be more calm? How do I be more connected? And I'm wondering your view of that in terms of psychedelics.
I'm all in favor. I mean, Valium blunts you, wine blunts you, and the moms drink all this wine, and the psychedelics open you up. The psychedelics enhance your consciousness. So, again, I mean, if you're going through menopause, you are going to need some hormones. It's a symphony, but I think the psychedelics definitely help you see things in a new perspective and give you a lot of resilience to better deal with the things that come your way.
Hmm. Hmm. So, so great. So there is that opportunity to go ahead and be more present, to have that neuroplasticity, that sense of interconnectedness, and that sense of calm. I mean, because there's a lot of trauma we're dealing in the world is filled with, lots of trauma. And how do we show up for ourselves and others?
Yeah, I mean, there is a lot of trauma, but you don't have to be defined by your past. And I think sometimes the only way to really move through it effectively is through the use of psychedelics. I mean, you can do it through meditation.
Mhm.
I actually just got back from a week-long meditation retreat with Dr. Joe Dispenza,
Oh, great.
literally like a couple days ago. There was
Hmm.
one on the other coast of Florida. And so we were meditating 4.5 hours plus
Hmm.
every day, and
Hmm.
and I think that the mind is powerful and meditation is powerful, but the psychedelics, they facilitate it. I mean, they just make it so much easier.
Hmm. Hmm. So, I think we've covered the woman's hormones. We've looked at, the role of some functional medicine, certainly your role into functional medicine, looking at the whole body mind connection, and then also looking at yoga and mindfulness. I am wondering, because I'm of a certain age, and when you get to a certain age, I think certain things, as you say, certain things start happening. I'm wondering, in your experience, looking at um, chronic pain and looking at inflammation, and I'm wondering how they relate to whether or not it's breath work, or whether or not it's mindfulness, or whether or not it's diet. What's your view of that? And are you working with people that are trying to manage that? And what do you say to them? And what can someone like me, you know or anyone else for that matter, what might they look at?
Well, pain is a very, very complex thing. And you have, the actual pain, and then you have people's whole emotional experience as it relates to the pain,
Hmm.
which is a really, really complicated topic. And so I think if you can get people to kind of again have a little space and have a new perspective on their pain, things can really change. Now, inflammation is a real, a medical thing. And so I think there's some medical things that you can do to reduce your inflammation. The biggest thing I tell everybody not to eat gluten. And I know that's controversial, but gluten really is so inflammatory. So I tell people not to eat gluten, stay away from processed foods, stay away especially from processed seed oils like canola oil, super inflammatory. Dairy can be very inflammatory for some people.
Hmm.
You're better off with goat and sheep dairy over American cow dairy.
Hmm.
But beyond all that, and I think those things are really important. I don't eat gluten. Like I think these things make a difference, but also I think with pain, you have acute pain, of course, like you can get injured and it hurts, but those things heal. And when you're left with a chronic pain like chronic back pain, which of course a lot of people suffer from, you know many studies show that when you do x-rays and MRIs, they really don't correlate well at all with the pain. And I know
Mm.
you want to look at an MRI and say, well, like I have, a partially herniated disc here and there, and this is why I'm in pain. But honestly, it's probably not true. And if you take anybody and you put them in a full body CAT scanner or an MRI, there are going to be little things, like there are things that you'll find. And what does it mean? Like most of it probably doesn't really mean very much. And so
Hmm.
people become very attached to their pain.
Mm.
But I think through the use of definitely ketamine and other psychedelics
Hmm.
as well, but ketamine for sure, you can actually reframe your relationship to your pain. And if you can Because what happens is, like, after a while, like, the injury has healed, but then your brain gets rewired into this chronic pain circuit. And
Mm,
so your body just keeps on producing, like, the nervous system keeps on just producing this pain through just this abnormal circuitry. And it really has nothing to do with, like, what may be going on with the anatomy of your spine. And
mhm,
so when you take ketamine, you can really reframe your relationship to your pain, and you
mhm.
can reframe the emotions that you have surrounding your pain. And if you're lucky enough and you can do it well enough, you can eliminate your pain completely, because you can ultimately convince yourself, when you're in this heightened state of suggestibility,
Mhm,
that you really are not in pain, and that there's really actually nothing wrong with you.
mhm,
It's just
mhm.
some abnormal, nervous system circuitry.
Right. So your view is not only diet, but also meditation or being present to what is there, and then also from the viewpoint of certain types of foods to really be aware that certain foods cause inflammation and certain foods can go ahead and, do you believe that from a diet viewpoint that each individual from, the viewpoint of their physiology or their biology or their overall makeup, that there are certain that everyone should go do some of these analysis in terms of what they're allergic to or what they should eat or what they shouldn't eat?
Well, like, everyone is different. Like, people have
Mhm,
variable sensitivities to things. And
mhm,
this is kind of, so I visualize it like this, okay? Is that, like, everybody has a little bucket inside them, and you
mhm.
can fill that bucket up with toxins and nothing will happen to you. But when the bucket is full and starts to spill over with toxins, then you will get sick. And the size of the bucket is to a large degree genetic.
Mhm.
And you're not a slave to your genes, but you have to kind of understand what's going on, right? So there are some people that can drink and smoke every day until they're 105 and they do
Right,
really
that's where I
well. And
was
then
going.
right. And
Yeah,
then there's
yeah,
other people, right, that have, like, there's
right.
really, severe lupus, and they die from it in their 20s. And
Yeah.
so you have to kind of be aware of how sensitive you are
Mhm,
to various toxins in the environment, and kind of
mhm,
work with it.
mhm. Yeah, I was definitely going to go there because there are people that I know that they can eat just about anything. They can drink just about anything. It almost and they're in their 80s and they're walking and they've got full cognition and their brains are working. And other people who I know that are in their 60s and it doesn't matter. They're just and maybe a lot of it is genes. It's just your overall you know
Well, I mean,
biomarkers and things you're born with.
there's genetic components
Hmm.
to it for sure, and you have to be aware of that. But there's also a lot of psychology involved in all of that. Like, if you start convincing yourself that there's a whole lot of things that you just can't eat at all because it's all going to make you really sick, again, there's a kind of
Mm.
a downward spiral there, and maybe you will benefit from, from a ketamine treatment.
Maybe a benefit from a ketamine treatment or going to the buffet and just trying stuff, seeing how it works. Yeah, yeah. I mean, to your point, I think there are people that are just very, very no matter what you do, it doesn't matter, and then other people, it's everything bothers them, right? Yeah.
Yeah. And there's, like, again, I mean, it's a symphony, but your thoughts are very, very, very important.
Hmm. 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 I like that. I like that a lot. Let me ask you as we start wrapping up our time here, what kind of advice would you give someone who's interested in exploring, the benefits of mindfulness or the benefits of psychedelics or functional medicine, or more specifically, if any women that are listening that are at a certain point in their lives and they're really starting to feel that they need to go ahead and get some help, what would you say to them and what kind of path would you point them at for health and well-being?
Right. Well, we do telemedicine, so
Hmm.
of course I will welcome anybody to come see me at the Medical Health Institute. And I did my functional medicine training at A4M, which is the American Academy of Anti-Aging Functional and Regenerative Medicine. And you can look it up online, A4M, and they will have a list of providers there, of graduates. And so you can look at the A4M website and find a functional medicine doctor in your area. That's a great place to start. And of course, yes, again, you can always come see me too, and
Great.
we get you evaluated. And I mean, unfortunately, there's a lot of gaps with conventional medicine. And when you go, I mean, I see people all the time, they go to their gynecologist, and, the gynecologist usually just says like, oh, you're fine, we're not going to do anything. Or they give you birth control pills, which is really not what people need. They need bioidentical hormones, not synthetic birth control pills. But again, like I was there too, saying like, well, I guess you're just going to be tired. So, if you don't know what you don't know, right?
Right. So, what is your website again, please? Would you repeat that?
So it's www.medicalhealthinstitute.com.
www.medicalhealthinstitute.com. And Dr. Amy Wecker is, again, a board certified internist and infectious disease specialist. It's great to have you as a part of the conference. I'm really looking forward to seeing you there and being a part of it. And I really appreciate you joining us on the show.
Thank you so much for having me. I have really enjoyed this conversation so much.
You're welcome. Thank you for joining us today, Dr. Amy Wecker. Your insights and perspectives on these important topics are invaluable, and we're grateful for the opportunity to learn from you. And we look forward to seeing you at the Wonderland Miami conference. To our listeners, thank you for tuning in to the Mindfulness Experience podcast. Remember to use Mindfulness 20 for a 20% discount on your registration for the Wonderland 2023 conference. We'll see you next time.